Hello and welcome back to Dental Chat. Today we're continuing our series of interviews with various specialists about what it's like to become their particular specialty. Today we have the pleasure of talking to Dr. Daniel Tan about prosthodontics. So join us and enjoy. Okay, well, welcome back. And today, in our continuing series of looking at the various specialties, we're kind of focusing on prosthodontics today. And today I have the extreme pleasure of talking to Dr. Daniel Tan, who is a Sydney-based prosthodontist. So welcome, Daniel, and thanks so much for agreeing to talk to us. What I'd like, Daniel, is first of all, can you just introduce yourself and give some kind of idea of where you currently are and what you currently do?
So my name is Daniel Tan. I'm a prosthodontist located here in Sydney. I currently practice in private practice in two locations, one in Norwest under Australian Dental Specialist and the other in Blacktown under Blacktown Specialist Dental Care.
Great. Yeah. Okay. Well, look, we're going to get into how you got into prosthodontics and what's it like very soon. But before we do that, just give us a little bit of background about the young Daniel. Okay. Well, before you even thought about dentistry, where were you kind of raised, and kind of what led you up to thinking about dentistry?
Well, I grew up in a really small town. I was born in a oil and coastal town in Malaysia called Miri, which is adjacent to Brunei. And it was a very relaxed town where a lot of, I guess, expats flew in and did their work and then they left. So I grew up in that town, and later on, my family relocated to Perth, where I completed my last 2 years of high school here in Australia. I then went on to do a short stint of engineering for about a year
Okay,
before
I
I
didn't know
actually
that
went
about you.
into before I went into dentistry at UQ.
You did a year of engineering. So to me, that kind of almost leads you down the path of prosthodontics, thinking about materials, the way that they might flex, the way that they may work. So why did you choose that, and why did you not complete that one? What made you think about dentistry?
So my whole family are pretty much engineers. So after completing high school, I was at that point where I didn't really know what I wanted to do.
Yeah.
So I thought, oh, there was no harm in doing what the family did. So I went into civil engineering and I loved it. I loved the fact that, it was, I guess, mechanical, constructing things, and I guess using your knowledge that you've learned in school in terms of science and
Mm.
mathematics. But I felt that there was a component missing. There was a human component missing, where I thought I wanted to help people and see the immediate change and also the gratitude that you could see with this with work. So I thought I wanted to do dentistry. And it was also something that I was thinking of when I was in high school. Um, I'm probably the fourth dentist in the extended family. So during that time, I was exposed to dentistry quite quite an early age. So I knew what was going on. So I thought, okay,
Okay.
let's
Yeah.
give dentistry a go.
So you did 1 year of engineering, then you switched over to dentistry. So that was another 5 years of dentistry. So at what stage did you start to think about prosthodontics? Was it during your undergrad or was it afterwards?
It was actually during undergrad um, when I started I started learning more about fixed prosthodontics, and I obviously bridges. So
Mhm.
I thought, okay, this is quite similar to what I kind of know, and it was more the the minute finesse of it, and also finding out more about different materials and different, I guess, compressive strengths of materials. So it was something that I was always fascinated in, and I think having the good tutors that always encouraged us, especially at the university, made me want to do prosthodontics more.
Mm. Yeah, it's interesting, of course, from your civil engineering background to moving to using some of the similar kind of concepts, except in a biological system. So rather than putting the bridge on supposedly solid ground with great foundations, you had to start thinking about biological concepts too. So you finished dentistry, you were thinking about pros at this stage. So when you finished your degree, what did you immediately go into?
So I relocated back to Perth for a couple of years, and I worked in private practice at that time. Uh, I think I was quite fortunate that I was able to find pretty good mentors that helped me throughout the first 2 years of my career. Later on, I relocated to Brisbane after 2 years. I went back for a sea change, I guess, and also I thought it was somewhere where I'm more familiar with. And at that time, I also worked in a private practice just on Wickham Terrace, which was close to the dental school and along the Royal Specialists. So during that time, I actually went into a few prosthodontic practices just to get an exposure of what it was like being a prosthodontist, and that helped really, really well. And I thought, yes, it's definitely something I wanted to do. And the prosthodontist that I was overseeing encouraged me to do my primary examinations, so that I could revisit, I guess, a lot of my dental knowledge. I found that the primaries were very, very useful because after working, a few years as a dentist, you could actually tie up everything that you've learned from an undergrad or DMD perspective, and it made so much more sense.
Okay, and you did this couple of years in private practice, but during this time, I assume that whilst you're in private practice, your interest in prosthodontics just continued, and that's what you kind of gravitated towards. And then you applied to do prosthodontics. So tell us about that. Where did you do that?
So I did my prosthodontic degree at University of Sydney under Professor Kleinberg at that time. The entrance into prosthodontics was quite a challenging and difficult one. It basically involved several steps. They look at your interest in prosthodontics, and they see how much continuing education that you do with regards to prosthodontics. They also look at your ability to treatment plan and also identify certain, I guess, problem lists. And during that time, they also assess your ability to cut crown preparations or bridge preparations. Obviously not a big part because they will teach you most of that in the training, but also they will look at some of your other skills in terms of presentation skills as well. So that's one of the entrance examinations into prosthodontics.
Right. So it's quite a bit of work to kind of set yourself up to get into it in the first place. And then during the actual training, some of the other specialists I've talked to said something along the lines of, in the first year, you kind of know little about what's going on. In second year, it all starts consolidating. By third year, you start to be able to really apply what you've learned. Is that kind of what you learned?
That's absolutely right. Absolutely right. Yes. Yeah.
Yeah.
You're
You're surprised
gobsmacked in the first year.
That's right.
You don't know what you don't know until you start the course.
Yes, and someone else said during the first year you don't question anything, you just go along, you're like a sponge absorbing so much stuff, and that it all starts to come together though eventually.
That's right, yes.
Yeah, I'm always interested about pros training. So is there a certain percentage of the course you do towards removables or fixed or implants, or is it all just meshed together?
It's usually all meshed together, but it starts off in quite a systematic way. So usually the first 6 months or the first 6 to 12 months is reliant on diagnosis, treatment planning, and also removable prosthodontics. Because a lot of removable prosthodontic concepts will flow onto the fixed pros concepts, and it relies heavily on changing the OVD, for example, getting the aesthetics right, making sure that you can test the function, the speech, and that usually comes from removal prosthodontics background. So a lot of it is very heavy in the first 6 to 12 months. And also in the first 6 to 12 months, they teach you quite a lot about oral facial pain and TMD, so that you know what the consequences are when you are increasing the OBD too much, for example, or when the patient's been in a lot of pain, and what to look out for. So that was very important, also very crucial for the first 12 months.
Right. Okay. So you've gone through the 3 years at Sydney Uni. You're a newly minted little prosthodontist pushed out into the world. So what did you get into? Where did that take you?
So that took me straight into private practice. I guess I was looking for a job, or to join a prosthodontic practice. But I think at that time there wasn't many openings into pros practices. So then I decided, I've got all this knowledge. I decided to join specialist group practices, and that's where I started. So I joined a orthodontist initially, and I found out, no, this wasn't for me because there was too many patients coming in and out. And so then I moved on to a perio practice, where there was a perio and myself as a prosthodontist working together. And then later on, joining Australian Dental Specialists as well, which had an endo, perio, and a pros.
Yeah, I'm interested in, you went kind of straight into private practice. Did you do any hospital work or public work, or was it just totally
Yes.
private practice right from the beginning?
No, it was part-time. So I was doing 3 days at the public hospital, a day or a day and a half of teaching at the university, and about a day and a half as well in private practice. So I was working quite a fair bit to pay off my student loans and my debts. And I was working very, very hard when I finished. And slowly later on, I tapered back.
Okay, well, got a question about that. You mentioned debts and finance. That's a big deal nowadays. People leave their undergrad with a substantial debt many times. Then to try and finance your way through the 3-year training, how did you do that? And the reason I ask that is there are going to be people watching this wondering how on earth can they fund it? So what are your thoughts?
So a lot of it was personal savings and the bank of mum and dad, fortunately, but mainly personal savings. So when you go for the selection process of entering a specialist program, most of the course coordinators will speak to the candidates about how they're going to fund themselves and what they're going to do throughout the 3 years. And I think they make it very realistic in terms of the cost it would take. But what I think a lot of students don't foresee is also the purchasing of equipment that you require, especially for a prosthodontic program. Like an articulator will cost you easily, $1,000 to $2,000, and you'll need several of them. And also you need to factor in that you'll be going to certain conferences that may not just be in Australia, but around the world. So you have to factor that in as well. So, you roughly have to budget around 40 to 60,000 a year in terms of expenses for each year for the program. Fortunately, for certain universities, for example, like University of Sydney, they do offer a small remuneration for working in the hospital. So New South Wales Health will give you a small sum, which actually is very, very helpful to help with the expenses. But certain universities, like University of Melbourne or South Australia, do not do that. So that's something that each student needs to weigh up as well.
Okay. Yeah, well, that's very good advice to plan and to understand the actual financial commitment to this. It's very significant, actually, which of course makes it difficult for some people in certain situations, family and other commitments and debt and mortgage to actually do it. So at least you've given them a realistic view of that. Okay, so you're in private practice, you start your own private practice. What are the challenges of running a business? And particularly, we've gone through the COVID years. You graduated, I think, in 2017, so you had a couple of years to get going, but then the COVID years hit.
It was tough. It was tough initially because we don't have any training in running a business. I think a lot of it had to do with the administration of running a business. So bookkeeping, accounting, hiring staff, finding the right staff that fits your practice. So that's the main challenges. The benefit of running your own practice is that you can order whatever you like without hopefully breaking the budget too much. But I think the biggest challenge is, I think, finding the right staff. That's always tough, and training them as well. Especially these days, staff come and go quite quickly. So I think once you find the right staff, it's encouraging a good culture within the work environment, and also giving them a sense of belonging as a valuable team member as well. So that's very important.
Yeah, that's a recurring thing that I keep hearing when running private practice is staff, and the difficulty in first of all recruiting really great staff and then keeping them. I have gone in and seen some of the cases, just looking over your shoulder, that you're about to start, and some of these large cases where people have neglected their mouth for 10, 20, 30 years, and suddenly they come in to see you. For whatever reason, they've got the money now, or they're just driven there by pain. And I look at what you're about to do, and I actually just shake my head and say, I wouldn't even know where to start. I mean, some of those cases are very complex, but I always see the prosthodontist as being the controller of things. So they come in to see you, but before you can start, and you know this from your engineering background, of course, before you can start putting the structures on there, all the foundations have to be right. So you have to think very carefully about who you're going to refer to. Do they need perio work, or do they need some surgery, first of all? So tell me a little bit about that in dealing with these large, complex cases that come in.
Yeah, so the most important thing is to actually diagnose what the patient has. And also, what really helps with the treatment planning of these cases is finding out what the patient's expectations are. I think a lot of the time we preset the patient's choice or the patient's expectations, but if we actually sit down and speak with them, we'll be able to find out what they really, really need and what they would like to help with their rehabilitation. But coming down with a good diagnosis and a problem list is what's crucial and what's key to helping you with the treatment plan. Because once you've got a problem list, you can then separate that out into this particular specialist and find out who you need to work with along the way. And what is also very important is that being a prosthodontist, as you're right, is like being a dental architect. You have to delegate each section or each portion of the treatment phase so that it's done correctly. And you have to actually keep that communication with the patient, the referrer, the dental laboratory. And this is to make sure that you're not only just improving or collaborate or improving the function and the aesthetics, but also the quality of life for the patient. Because what's actually very important is that the patient came to see you and would like to leave the clinic, better off, whether that's function, aesthetics, but also quality of life. So that's very important for comprehensive care. And I think a lot of the times patients come in seeking treatment, not knowing what the long-term maintenance and the follow-up protocols are. So, briefing them about the maintenance and also what they're embarking on with a particular type of treatment is very, very important. So like, for example, a dental implant is not just a simple tooth in a day. You need to actually brief them on what needs to happen over the long period of time. Because at the end of the day, if it's the patient that needs to look after the prosthesis, and we can only do so much, and a lot of it is patient education.
Yeah, Daniel, I think that's so important, particularly when we're starting to talk about some people who are getting, towards their 50s and 60s. If we're about to put in a very large structure involving many implants, bridges, various things that all have to be maintained, as these people are getting older and unfortunately, may end up with dementia or other problems, and in retirement villages where the oral hygiene's not maintained, they've suddenly got all this structure that needs to be maintained. The other thing you touched on was the aesthetic side of things. That I see as being so important nowadays, having realistic expectations from the patients. And I think that that's huge because you can spend a fair bit of time explaining things, but even though you do, if the patient's expectations are somehow not aligned with what you've told them, that's where trouble can start. So would you like to comment on that?
Oh yeah, definitely. Especially these days, with a lot of a strong social media presence, I see that a lot of the younger patients have unrealistic expectations, and a lot of them, because they are using filters on their phones, uh, we have to be realistic and to explain to them what the difficulties are and the challenges that we face as a clinician, rather than get just having aesthetics, because it's not just about aesthetics, it's also about function and also long-term wear. So, what can be possible may not be practical in the long term. And I think showing that to the patient, and that can be done by multiple forms. It can be done with a trial mock-up, which is basically having a diagnostic wax-up or a digital wax-up, and then transferring that into the patient's mouth and letting them have a feel and a look and seeing how the teeth move against one another would actually help to open up their minds to what can be possible versus what they see online. And I think that's very, very important. What we're also finding is a lot of patients are very focused on, I guess, the whiteness of their teeth, which is great at the initial stage, but they need to factor in that, in the long term, so if we're talking 10, 20, 30 years down the track, would they be maintaining that physical appearance and also the brightness of their teeth as well? So I think it comes back to, again, the maintenance and the follow-up care, and letting them be aware of what will happen 10, 15, 20 years down the track.
Now, just for anyone watching who is thinking about possibly going down the prosthodontic path and wondering what it's like years down the track, take us through a typical day of a prosthodontist.
I currently do 3 days a week in private practice, and I have a day or 2 days of admin a week, and I think that's pretty common for most prosthodontists. My typical day usually starts around 8:30 and I finish around 5, and it involves a variety of things, from consultations to treatments, reviewing cases, communicating with the laboratory to ensure that things are going as planned and as tracked. Especially with prosthodontics, a lot of it has changed over the last 4 to 5 years with the new introduction of digital impressions, 3D printing, CAD/CAM technology. There's so much that's out there, and there's so much literature out there as well, that it's important to have a balance between what is good evidence and what is bad evidence, and also what helps in your practice and what actually creates more work. So I think it's also important to strike, I guess, a work-life balance, and it's important that I always spend time with my family, especially on the weekends. And I think also to keep up with regular exercise to ensure that you're healthy. Because I guess with prosthodontics, it's one where when you do a complex case, you may be there with the patient for a number of hours. It's a long game, so you want to make sure that you've got a healthy physique, that you stretch once in a while, and make sure that you keep everything healthy.
Thanks, Daniel. I think you've given a pretty realistic and good view of what's required to get into prosthodontics, what the course is like, what your average day is like. So to sum it all up, to finish it up, for that dental student or the young dentist who's watching is thinking, yeah, look, that all sounds great. What kind of would be your final advice or recommendations about doing prosthodontics as a career, as a specialty?
Oh, it's great. I love it. It's obviously challenging. There's a lot of paperwork behind the scenes, but I think if you are thinking about specializing in prosthodontics, start by getting a good solid foundation in general dentistry, and explore different specialties to find out where your passion lies, and be prepared for a challenging but also a rewarding journey. And what's important is not to forget to keep patient care at the forefront and stay open to learning different concepts and be open to technological advancements. I think that's very important.
Okay, well, look, Daniel, thanks so much. Really appreciate you coming on and explaining the world of prosthodontics to people. Thank you so much and have a great day.
Thank you. Thank you for having me. Thanks, Steve.
Okay, bye.
Bye.
Well, thanks for joining us today. I hope that helped explain what it's like to become a prosthodontist and what the day-to-day life of a prosthodontist is like. I look forward to bringing further interviews in the future. Have a great day. Bye.